Okay, so the next rehab series is going to be thoracic spine, also known as your mid-back. So, oftentimes when there's a problem in this area, you don't necessarily have pain in your mid-back. You can have neck pain, you can have shoulder pain, very connected to shoulder issues. So, if you came in for a shoulder or a neck problem and you're getting this exercise list, it is not a mistake. We feel as though this would be important for rehabbing your neck and your shoulders. So this is going to be a very quick video because the thoracic spine really doesn't have a lot of movement. It basically extends and it rotates. So there's going to be one exercise for each. These actually are going to be more like stretches, a little bit of muscle activation, and anyone should be able to do these. We will try to tell you the ways you can do this at home because you might not have the weight bench and you probably don't have a PVC pipe laying around. You don't have to have a PVC pipe. You can use a broomstick. You can use nothing. So this is just the best way to do it, and then you can kind of adapt it. I would rather you do that than not do it at all. So we're going to do it on a bench. You could do this on your coffee table. You could do it on the side of your bed. Anything that has a flat surface you can put your elbows on. So extension first, and then we'll go into rotation. So what you're going to do is you're going to take this PVC pipe / broom and you're going to hold it like you're going to do some curls. And then you're going to go on your hands and knees. You're going to put your elbows on the bench. And then you're going to push your head and your chest down to the floor as such. Come back up. Go back down. Back up. So it's important that you're not just extending in your low back and getting no chest movement, so don't just do this. You've got to kind of push your head and your chest down and then come back up. So that is how you do extension. You can do it without the bar. You just put your hands together or however you want to do it. Great exercise. Foam rolling your mid back is also a good way to work on extension. I don't really need to show that. But I guess I will. So, let me get a foam roller and I'll show you how to do that. Okay, so if you can't do that, maybe it causes shoulder pain, which would indicate that you have an issue going on in your shoulder, possibly tight lats, possibly something else, ask the doctor. Then foam rolling is also a good option. So, what we're gonna do is you're gonna start with this foam roller about the bottom of your shoulder blades roughly. And then what I like to do is at the bottom part of my low back, I cross my arms and lift my butt, keep my core contracted, don't let it do this, and then just kind of roll until you get to like your shoulder blades. At this point, what I want you to do is put your arms over your head, don't look at my belly, and then you're going to roll back here. So you can kind of lean back a little bit and really put pressure into it, or if that's too hard, you know, kind of lean up a little bit and just roll. So here, you kind of find a sore spot, lean back into it some, and then keep going. So that's a good option for thoracic spine extension as well. And then we're going to go into thoracic spine rotation. So, like I said, the thoracic spine mostly just extends and rotates. That's the important part that most people are missing. So thoracic spine rotation is next. This is also very important if you have pain between your shoulder blades. Okay, so thoracic spine rotation. What you're gonna do is you're gonna do hands and knees again. I'm gonna show you from the front. I'll try to show you from the side, but the front view is the most important. So, you can go on your knees, and then you're gonna lean down to the ground. You're gonna put one hand underneath your forehead in a fist, and the other hand on the back of your neck, and you're going to keep your head pinned to your hand the whole time. Don't lift it up. So here, and you're just going to rotate and then back down. Rotate, back down, switch, back down. Do it that way. So same kind of thing. This is a little bit more of a stretch, 10 to 15 repetitions, 2 to 3 sets. Always build up, increase your tolerance. And that should help. You should feel this pulling in between your shoulder blades. That's how you know you're doing it right. Most important thing, keep your hand peeled to your head, stuck to the ground.